Good evening, everyone. Thank you for joining today on another webinar, which promises to be very informative. Tomorrow is, that is the 20th of March, is World Oral Health Day. And we've been receiving questions around issues that persons with diabetes have and people with cancer have and rheumatic diseases. And we thought it was a good occasion to bring together a expert and get some of these questions answered. So we are very pleased to have with us Dr. Mariya Khambati, who is a dental practitioner in UK for over 27 years. She studied in India in Ahmedabad and then went to UK and studied there and then started practicing. A quick reminder for people who are following us or who may be new to PatientsEngage, we are an online platform. Our objective is to inform, engage, empower patients and caregivers. We focus on evidence-based management of chronic conditions from the perspective of patients and family caregivers. And as a lot of you may be aware that we focus a lot as well on lived experiences, and often our discussions and questions and even our sessions with our experts come from that, the background of the questions that patients have or the family caregivers have. So I won't take too much time. The quick guidance to our attendees is that this is not to be taken as medical advice. It is based on experience, but for specific medical issues, please do consult your physician. This session is being recorded, so if you're logged into Zoom, please post your questions on the Q&A. If you're on Facebook, post them on the live feed, and we will pick them up and answer them as we go along. And if you ever have any experience that you want to share or you want to write into us, you can always do so at editor@patientsengage.com. And as always, you can follow us on our website, patientsengage.com, or our social media pages, Facebook, Twitter, Instagram. And you can also, all our webinars get recorded and uploaded on YouTube as well. And if you don't want to miss any of our daily posts, then you can download the Android app from the Play Store as well. And just a quick reminder, I'll stop sharing. So we have today, as I said, Dr. Mariya Khambati, and I am Aparna Mittal. I'll be the host for the session today. So let's get started. Okay. Dr. Mariya, hi. Thank you for joining.
Just call me Mariya. It's so much easier.
Okay. Yeah. All right.
Hello, everybody. Good evening.
Yeah. So I guess I would like to start with the basics of what does good oral health really mean.
Right. So basically, if you divide your mouth, we have three things we want to look at: your gums, your teeth, and all your soft tissues. For good gums, of course, good toothbrushing is really important. And when I say toothbrushing, it's not just literally, toothbrushing is, people think sometimes that they're brushing their teeth, but they may not be doing it correctly. So correct toothbrushing, which should also involve cleaning between the teeth. And that's very important because that's something people tend to forget. And when we talk about teeth, mainly it's decay. And the best thing for decay is stop eating sweets.
Right.
It's the sweets and the frequency of the sweets. And then have very good regular dental checkups, because checkups not only look at your gums and teeth, but also all your soft tissues, and which is very important for diagnosing cancers, which I think is really important because there is a big rise in oral cancers.
Right. Okay. So I know typically as a layperson, we don't do the regular checkups. We visit a dentist when we have a toothache or there is, we feel that there's a shaking of the tooth. Is that sufficient?
No, I don't think so. The trend should be, you should have regular checkups. When I say regular, we here, we tend to uh, put our patients as high risk, moderate risk, and low risk. If you come in the high risk, I would say every 4 months we do a checkup.
Mm.
If you're on a moderate, we do it 6 months. If you're low risk, you can go to 12 to 18 months, but you can't exceed more than 18 months. You should have a checkup. That's what I
Right,
think. Yeah.
right. Okay. Um, and since as a platform we focus a lot on chronic people
Mhm.
managing chronic conditions, are persons with chronic diseases more at risk for dental issues?
Yeah, there are a whole group of them. I mean, let's face it, in the subcontinent, southeast continent, diabetes is the biggest factor.
Hmm.
And then you have, I mean, now all types of cancers. There's so much implication with oral health and and cancers, not just oral cancers, but any cancers affecting any part of the body. And
Right.
then you have heart disease, epilepsy, so many drugs you are taking, antidepressants, all that will affect your mouth.
So it's not just the disease itself, but also some of the medications is what you
Mhm.
are.
Absolutely, yeah, absolutely. I mean, in UK, we are very hot on certain medications. Mainly, it's chemotherapy and also people with treatment of osteoporosis and some of the medications that are used for osteoporosis, they really can have quite serious implications for any kind of invasive treatment.
Okay. So let's start with the diabetes, right? So, what are the common issues that people with diabetes would see?
So, problem with diabetes, the main thing is gum disease.
Hmm.
It's the biggest risk factor for gum disease. And if you're diabetic and if you are a poorly controlled diabetic, then you will see the incidence of gum disease, and associated with the gum disease will be your bleeding gums, movement of teeth. You will find that you get spaces between the teeth, your teeth are moving, and ultimately it's tooth loss.
Mm.
And another thing with the diabetes is it comes with other factors as well. Sometimes you have the obesity and associated heart diseases, poor nutrition, they all will work as a collateral, which will
Right.
then affect the gum disease even more. Another thing is it's a two-way relationship between diabetes and gum disease. And if you have gum disease, you're again a bit more prone to diabetes as well
Hmm.
because of your glycemic index. So if you're a diabetic, I would say you really should have regular checkups, regular hygienist. Make sure you follow a very optimal oral hygiene routine, and that will help you stabilize the condition.
So when you say, you are at a risk if you have diabetes, which category would you put them? Because you defined high, moderate, and low risk. So
We would put it as a high risk there.
high risk. Okay.
Yes, yeah. And especially if you have, I mean, diabetes type 2 is worse than type 1. I mean, type 1, of course, is more control for younger population, but type 2 is the older population, which then creates another group of, we'll go into detail, I think, later on about it. But yes, diabetes is high risk, and I would say 4 to 6 months checkups and hygienic treatment, very important.
Right. Right. Um, and do you want to elaborate a little bit for people in terms of, what are the gum issues or what would be the symptoms that they should keep an eye out if they have diabetes? So
So
somebody
gum
also
disease,
mentioned that most of them end up wearing dentures. So is there a way to delay that, or is that inevitable, or is just that if you managed it well, you didn't need to?
no, you know it shouldn't be inevitable. I mean, prevention, as I say, is the best therapy here. So if you follow all the guidelines, you go for your regular checkups, you have your hygienist treatment, you really clean your teeth well. When I say clean your teeth well, do it twice a day,
Hmm.
right? And do it twice a day, at least for 2 minutes, all the surfaces of the teeth. If you find the manual toothbrush is difficult, go for an electric one because
Hmm.
that does the job for you. As long as you put the electric toothbrush on all the surfaces of the tooth, it will give you the right movement. And make sure you have, when you brush your teeth, do it after breakfast,
Mm,
because then you will not be eating or drinking for, let's say, at least half an hour to an hour, which will allow all the toothpaste to work. Do it before, just before you go to bed,
right,
and do the interdental cleaning. And if you do that, and with a good diet as well, you should have good oral health.
right, right. Okay. Um, Again, if there are questions from the audience, please do ask them. Just type them in. And let's move on to heart disease.
Mhm.
Does heart disease itself lend itself to having dental issues, or is it more the medications associated with?
So there is a study saying that if you have gum disease, you are more prone to heart disease. Okay.
Right,
And but some of the medications have a direct effect as well in implication for treatment. Now, one of the most important group is the calcium channel blocking. All those beginning like amlodipine, nifedipine.
mm,
One of their side effects is it produces swelling of your gums, especially if your cleaning is not very good.
right,
And that can be quite distressing, because with the swelling will come the bleeding. You will find your teeth will start moving as well, which cosmetically doesn't look very nice.
mm,
And another group of medication is the anticoagulants, which I don't know how much warfarin is prescribed in
it is
the
fairly
United
common.
States.
It is fairly
So
common.
if you are taking warfarin, dental treatment can be difficult, because especially extractions, because bleeding is a problem after warfarin.
Mm,
And if it is other, there is another group here, which in UK, most of the warfarin is now taken over by a group called Apexiban, and which are more easier to control, because you can actually stop the medication for 48 hours, do the invasive procedure, and patient goes back. But with
right.
warfarin, it's difficult. You should never stop warfarin. As a general dental practitioner, I would not do that.
Mm,
And then you have to liaise with the patient's hematologist. So that is another scenario where heart disease can give us a problem.
okay. Okay. Um, Before I continue, there's a question that says, please elaborate on oral care for COVID-19 patients. Is there anything specific that has come up on that?
Not really, no. I mean, there's a lot of speculation about using a mouthwash prior to sitting in a dental surgery,
Hmm.
which we started using it, and it was a weak sodium hypochlorite solution, really. But it only lasts for a couple of minutes or so, and then you're back to the same pathogen. But COVID-19, no, not really. I don't
Right.
think. No.
Right. Okay. Also, one other question that's come up is, are implants good to do, or caps?
Right, that's a complete two different scenarios,
Right.
right? It's a big topic, that
It's a big
is.
topic. Okay.
And implants are sold very popularly, but implants have a lot of problems. So
Hmm.
I would say, I mean, it is beyond the source of this little topic that we are doing at the moment, but treatment planning is most important with implants.
Right.
Otherwise, you are worse off.
Right.
A well a well maintained tooth, even though it has gum disease, is still better than an implant tooth.
Hmm.
Right?
Hmm. Okay. Got your point. Let's move on to, I think you mentioned bone disease. So osteoporosis. If
Mhm.
people have osteoporosis, are there common dental issues that they face, or
It's
are
just
there
the
risks?
medication. It's only the medication. And so the most important group over here, I mean, in the UK, there's a lot of prescription for the bisphonate group.
Hmm.
And bisphonates, if they're given as a oral medicine, like taking in a tablet form, it's not too bad.
Right.
But if they're given as an injection form, then yes, before you start the treatment with the injection form, you must, that is an absolute must. You have to go and see your dentist.
So even
And
injection, there are multiple types, right? There is the daily one, And then there is somebody mentioned that there is they go and get I think once a month or something they
Yeah,
get an
as a
IV done.
month. Anything by injection. You
Okay.
have to have a checkup, and any teeth which have a poor prognosis, they should be extracted prior to the start of bisphenol treatment.
So supposing you've started bisphonate treatment, right? Especially if you're on the daily injectable and you are taking it every day for you're supposed to take it for 1 year or something like that.
Yeah.
So if in the meantime you have a tooth problem, are
Mhm.
you supposed to stop
So
bisphonates or how does
no,
that
no,
work?
you can't stop this. I mean, you would not make, as a dentist, I wouldn't make that decision.
Right.
Okay. And what you have to then do is, are you able to save that tooth by other means, a root
Hmm.
canal treatment? Um, if you can, yes, please save the tooth, even if it is for a short term,
Hmm.
because extraction carries the risk of necrosis of the bone.
Right.
And really, an extraction is really a no no.
Hmm.
So so that is why, I mean, again, in the UK, is the if patients are starting with bisphonates, they will have a checkup. The dentist has to write a letter saying all teeth are fine, and only then they start the bisphonate treatment,
Right.
because jaw necrosis is a big problem. And
Right.
it's the same with certain, it's not just the bisphonates, but there is a group of medication which are used for treatment of bone cancer,
Hmm.
and that's denosumab.
Right.
Again, they carry the same implications.
Right. Right. And since we've moved on to cancer, are there other cancer treatments that cause dental issues in the long
So,
run?
no, not cancer treatment, but yes, patients who are on chemotherapy, for example. And we are
Hmm.
not talking about head and neck cancer. We are just talking about general cancers.
Right.
And prior to start of treatment, it's best to have a checkup, right?
Hmm.
And the problem with chemotherapy is all the side effects that it creates.
Hmm.
The number of side effects. Your salivary glands is affected, so you have reduced salivary flow,
Hmm.
and that makes you then very high risk to gum disease and to decay in the mouth.
Hmm.
Also, your taste is altered.
Right.
Your immune responses are slow. You are more susceptible to ulcers in the mouth.
Hmm.
And again, invasive treatment like extraction carries a risk, because when you are on chemotherapy, two things happen. A, your WBC, your neutrophil count is low, and your platelet count is low. With
Exactly.
the low platelet count, you will encounter bleeding problems after an
Hmm.
extraction. So if you have to plan an extraction, it's not an impossible feat, but it's better to have all your platelet count 48 hours prior to the extraction.
Right. Right.
I would suggest that if you are going to have an extraction, usually chemotherapy, there are breaks in the treatment, and you
Hmm.
have to take advantage of the break time and have the treatment during that time.
Okay. And couple of cancer survivors brought up a couple of issues which said that um, they faced loss of enamel
Mhm.
and so had to fix a cap. And the other issue they felt was that the gums were loosened, which created many issues.
Okay, so again, as I said, this could probably be because of the actual treatment, the side effects. So we are, all patients on chemotherapy are high risk to caries,
Mm,
because they don't have enough saliva. Saliva gives you a good protection against decay because of the calcium and phosphates it has. Also, the saliva has a good washing effect. It clears your mouth with all the plaque, which you don't have. So
right.
you will lose enamel quite a lot if you don't follow the regime, in the sense if your oral hygiene is not good again. Also diet. Sometimes cancer patients are given those nutritional drinks, isn't it?
Mm, mm.
Um, in order to improve their general health
Yeah,
and
the
gain. Yeah.
nutritional supplements. Yeah,
Yes, and those nutritional supplies are full of sugar, absolutely
right.
full of sugar. I would say that if you are having those, maybe a simple procedure by drinking it with a straw will help you, because it will not contact your teeth. So
Mm,
you will get the nutritional benefits without causing damage to the teeth. Another thing what we do in UK is we prescribe them a very high fluoride toothpaste
Mm,
for regular use. Now, I did check in India, it's a bit difficult. I think you don't get, it's marketed by Colgate, and it's called Durafat, which is a prescription only toothpaste. And there are two different strengths, and we give the highest strength for the any cancer patients.
right.
And that
Right.
helps in prevention of decay.
Right. Okay. Okay. And the use of straw is useful irrespective of whether you are
Irrespective,
on.
yeah, even young teenagers, for example, I mean, they are on high drinks, isn't it? All the Red Bulls, Coke, even some of the drinks. I mean, I've actually got a list of drinks and the sugar content that is available in India, and all those drinks are terrible. So yeah, a straw will help you.
Right.
You can taste
At least
and
from the,
perception.
at least from
This
your
point of view, I
dental
mean, not really
perspective.
healthy,
Right.
not healthy, but still, yeah, yeah,
Right. Right. Um, a- um, what was it? Yeah, talking of saliva,
yeah.
also we hear of quite a few people who talk of dry mouth, right? So it's common in some of the rheumatic diseases. Um, Sometimes even among the elderly, you come across issues of dry mouth. How do you, um, what's your approach to handling that, or what's your recommendation?
So it's the same thing, still classed as high risk for dental diseases, 4 month to 6 month checkups, fluoride toothpaste, but a prescribed one. So we normally prescribe at 2,800. I know
Mm,
it's not available in India, but India does do a fluoride application gel, and you could ask your dentist regarding it. A fluoride mouthwash is also available, and that's quite useful. So
mm,
again marketed by Colgate, and best and a non-alcohol version is also available there. And when you use any mouthwash or a toothpaste, don't rinse afterwards.
mm,
So you get the maximum benefits of the fluoride, at least for half an hour, and that will help. Rinsing, just sipping water will help,
right, right.
and
Okay.
also cut down your sugar in your diet. That will help.
Mm, mm, okay. And if you are received a couple of questions. Okay, so somebody says some 25 years back, dentists wouldn't suggest a root canal in a hurry and a cavity filling would suffice. But now it's a root canal most of the time.
No, I
Is
don't
that
agree with that. No,
no?
no, actually, I actually disagree with it, because now we are trending towards a minimal intervention treatment. So we try and save the pulp, the root, avoid root canal as much as possible.
Hmm.
And we find dental materials, some of them are really good, because you can actually,
Can you lift your head up a little
should I
bit?
lift my
Sorry.
head up? Yeah.
Yes, thank you.
Is that better? Yeah.
Yes, thank you.
So some of the materials now available, I mean, we use that very routinely here, is we actually leave a little bit of decay behind, but we
Hmm.
seal the cavity with that material, which actually releases fluoride as well. And teeth have a remarkable capability. They can actually remineralize. And that will heal and will form a nice little bridge. So you don't have to do root canal.
Hmm.
I would do root canal as a last resort.
Right.
Root
Right.
canals, root canals are complicated,
Hmm.
right? If they are not done properly, your prognosis is not good.
Correct. Correct.
Long-term treatment, 5, 6 years, you lose the tooth. So let's
S-
start just reducing the root canal and take advantage of all the materials available to avoid
So,
them.
would you then suggest that people, as patients, should get a second opinion if um, because
See,
it's
I
one
don't know
thing to
how it
tell a
works in
dental
India, right?
practitioner.
I mean, for us, UK, for us, treatment, there is a lot of transparency in treatment, and
Right.
for us, I would be very upset with myself if I prescribed a root canal when I could have still tried
Mm,
just using glass ionomer materials and see if I could avoid it. And we've done that over the years
right.
brilliantly. It's satisfying that you monitor the tooth every 6 months and you realize, hey, it's healing.
Mm, Mm.
Um,
Right.
I, I couldn't other second opinions. I don't know. It's a very
Right.
I won't
Okay.
get
Not
involved
putting
in.
you in a spot, but
No, I
well, I
can't
did.
get involved. I don't know how it works in India. I really don't.
Right, right.
Yeah.
Follow-up question on your fluoride treatment.
Mhm.
How often is fluoride treatment at the dental clinic for dry mouth patients? This is someone with from
Okay,
Sjogren's.
so
So, because
okay,
in
so
India there is no specific norm.
okay, so because over here in the UK we just give the patient the toothpaste, we don't provide any surface treatment. Surface treatment we only provide for children
Hmm.
under 14 years old, and we do the topical application. But where you don't have, I would say maybe every 4 months you could have.
Hmm.
But I think when I checked it, you a sodium fluoride mouthwash is available in India. You
Hmm.
also have the Sensodyne toothpaste,
Yeah.
which has 1,000 ppm, and you could use that as a regular toothpaste.
Hmm.
And one thing essential, very essential, I will always emphasize this, is please don't rinse your mouth after the toothbrushing. Just spit all the excess out,
Hmm.
and that will benefit you a lot more. And you can also use the little brushes, the interdental brushes in
Hmm.
between the teeth, and you can dip that in the mouthwash a little bit and go in between, and that will allow the fluoride to stay on your teeth.
Right.
Another thing I would like to say is about the health shop toothpaste. I think there are a couple of them marketed in India as well, and they don't have any fluoride in it. So
Mm-hmm.
read the ingredients.
Okay, she mentions somebody says I use Elsense toothpaste recommended by my dentist and interdental brushes. This is someone
Okay.
from
Okay.
Sjogren's.
I mean, I don't know the essence. You would just have to read the ingredients and check. As long as it says sodium fluoride or stannous fluoride in it, then that's fine.
Okay, thanks.
Another Can
Sorry,
I
go ahead.
is people with cancer. I mean, we sometimes prescribe them toothpaste which is free of sodium lauryl sulfate. I don't know how much of SLS is important in India, but it tends to reduce ulceration in the mouth
During the chemo.
during the chemo. Yes,
Okay.
and
Sorry, can you say that again?
so
We'll
toothpaste
just make
containing.
sure that we'll put it in our notes as well.
Yeah, so toothpaste containing sodium lauryl sulfate, or SLS as it's.
SLS. Okay.
Yeah, and they do have an increased tendency to cause more ulceration in the mouth. So many patients prefer to have SLS free, but Sensodyne do SLS free toothpaste as well,
Okay.
and
Okay.
they're pretty good. Yeah.
Right. Right. Um, Question, is bleach good for stained teeth?
What do you mean by bleach?
How to remove stain from teeth?
No, bleach. No, there is a specific procedure we do tooth whitening where we
Mm,
do use hydrogen peroxide or carbamide peroxide for whitening the teeth. It will
mm,
not remove your stains. You would have to have your teeth cleaned for removing the stains.
right.
Tooth whitening will change the color of your teeth
Mm,
but not remove the stains.
right. Right. Um, and if you improve the your cleaning routine, will the stains go over time, or once they are stained, they are stained?
Find out why the stains are coming in your mouth, first of all. That's the most
Right.
important. So if you're a smoker, well, the answer is no, the smoke, it will
Mm,
keep coming back. Red wine, coffee, especially black coffee, black tea, that
right.
stains,
Right.
yeah. Yeah. But it's okay. Stains don't look good.
Mm,
Um, and it's simple. Go to your dentist, have a teeth clean. They'll go away.
right. Right. Um, One question on, and I don't know if this is really what you want to address, but does jaw alignment have a cure? I think what happens with some people, they find that the teeth don't sit properly, right? And that causes aches in the mouth. That if the teeth are not kind of the top and the bottom don't kind of sit properly.
Is that because of some restorative work that they have had done, like crowns and bridges, or
Don't know. Okay, we'll see if
yeah,
the
I
person
will have
clarifies.
to have
So
that.
if you're
I mean,
listening, you can
yeah,
clarify, and we'll come back
yeah,
to
we'll
it.
have to clarify that question a little bit more. Yes.
Right, right. And people with, so let's look at the elderly. I think we've got a
Mm-hmm.
couple of questions on
Yes.
the
Mm-hmm.
elderly as well.
Yeah.
Um, what are the, uh, when do they become high risk? And also, it's not often easy for them to be taken to dentists and to go through the dental treatments. So, what are, and even for some of them, even regular brushing can become a challenge.
Yes, it
Uh,
can be. It can be, and we do know that people are living longer and longer now because of good medicines and things like that. But simple things again. Um, I find maybe sometimes the manual dexterity is not so great.
mm,
Maybe get them an electric toothbrush that will help them because it's much more easier to brush that way. Mouthwashes can help here. So you could have either fluoride, or if they have gum problems, you can have Corsudyl mouthwash, which is again quite readily available, which is a chlorhexidine base. Um, they're quite good. Um, Make sure good diet, cut down the sweets, the sugary food as well, because
mm,
I find, I mean, this is what I find with my older group of patients is eating biscuits and things like that increases as you get older, and again, that's not only poor nutrition but also affects your teeth.
right.
um, and also quite a lot of these older patients are on a lot of medications, and
Mm,
medications, the common group of medications like those on high blood pressure tablets, um, diabetes tablets, even asthma inhalers, all these all will cause drying effect of your mouth,
mm,
and that again can affect the oral health. If they're wearing dentures, make sure the dentures are fitting well, because an ill-fitting denture can cause mouth problems as well.
right.
And also they can be more susceptible to fungal infections like thrush again.
Mm,
So make sure the dentures are good.
right.
And denture hygienes should be good as well.
Right. Right. And again, so follow on that. Is there any recommendation for patients with severely dry mouth who find it difficult to wear dentures?
That is a big problem. Yes, that is
Mm,
actually a very big problem. Um, so, I mean, you could give them salivary substitutes. They do help a bit. Sipping water helps a bit.
mm.
Um, Sometimes
Sometimes people start thinking that you should suck on uh, a lolly.
you could, if it's a sugar-free one, yeah, you could do that. Yes, that would
Okay.
help. Yeah, even chewing gum. Actually, sugar-free chewing gum helps in salivation. So
Hmm.
yes, if you have a dry mouth, as long as it's a sugar-free chewing gum, by all means, it's good. Yeah,
Okay.
yeah.
Okay. So that reminds me, when you talked of the nutritional supplements for cancer patients,
Mm-hmm.
if they take because there's also a category now for diabetics
Mm-hmm.
as well now, yeah, under the nutritional
Okay.
supplements. Would that be easier, or would that cause less harm in terms of the sugar content?
You have to find out how
You'll
much
have to
sugar
find.
content it is. Yes, yeah.
Right.
And if
Right.
there is a sugar content, and if your
Because
health
they
requires.
obviously substitute the sweetness with a artificial sweetener.
Okay, okay, fine. If that's the case, okay, but otherwise, just make sure how much sugar is in it.
Right.
The straw. I
Right.
find that's the best option there.
Right. Right. Okay.
Mhm.
And coming back to the elderly, are there other recommendations or any advice on how to support them, especially as the muscle tone also gets affected, right? So they sometimes their mouth stays open longer. That also causes
Causes it.
dryness.
Yeah. But dryness is a big it is a complicated subject, okay? And as I said, there is very little available in terms of a quick medicine to
Hmm.
reduce. There isn't anything available. Even the artificial saliva, just as you have the artificial tears, don't really give you a long-term relief,
Right.
right?
Right. Yes.
Another thing, if they are wearing dentures, make sure they remove the dentures at night time. That's
Mm,
really important because at night time the salivary flow is really less, so that will cause more problems there.
right. So this person's clearly tried out lots of things. So the problem with chewing gum, even sugar-free, is most dry mouth patients have dental caps, which come off if you chew too much gum.
No, they shouldn't come off. No,
No?
no, no. A good crown shouldn't come out that easily.
Okay. Okay.
Okay.
One question from somebody who's is saying that, do inhalers cause damage to the teeth
It depends what
for
kind of
asthma?
inhalers.
So,
Okay, so
right.
it depends on what kind of inhalers it is. Okay, and so you have the steroid and the non-steroid one.
Mm,
Steroid inhalers are makes you at a greater risk from fungal infections like thrush in the mouth, most commonly in the palate. And the
mm,
best way to avoid that is after the inhaler, just drink either a glass of warm water or rinse your mouth with nice warm water, and that is sufficient.
mm,
And the other group of inhalers, especially the dry powder ones, they make your mouth more acidic.
mm,
And when that happens, you will be losing your enamel, especially on the insides of your top teeth.
right.
And things how you could avoid that is, again, you could actually rinse your mouth with a fluoride mouthwash. If you're using the inhaler at night time and then just going to sleep with it, then yes, stop, don't do that. You must have a mouthwash or brush your teeth afterwards. And another thing with inhalers are they also cause dryness of mouth. That's another side effect of
Mm,
that. You could use a spacer if you think that you are getting a lot of problems with the inhalers.
right.
Spacers can solve a problem as well. Mhm.
Okay. Okay. Um, have you noticed, because the questions come up in the current pandemic situation, the
Mhm.
effect of wearing masks continuously creates a kind of bad breath. This also says causes discomfort, but that's different. But bad breath, have you come across that?
No, that means they need to have your teeth cleaned.
Right.
They'll give you
They
to a
haven't
dentist.
gone for a dental
Yeah,
checkup for a
yeah.
long time.
Also, remember, bad breath could be dry mouth as well. So maybe drink a little bit of more water
Mm,
because mask will tend to dry. I mean, I tell you from my own personal experience, when I start my treatment and I had to wear those heavy FFP3 masks, always drink a glass of water before and a glass of water after.
right.
So
Right.
maybe they can try that and it will help. And go to the dentist as well.
Right. Um, some people also grind their teeth,
Yeah,
especially
that's
during
good.
sleep.
Yeah,
Um,
yeah,
again,
that's fine.
what's the recommendation for them?
So basically, it's a subconscious habit. We call it we parafunctional habits. It's not just grinding. Sometimes it's clenching as well, and they might notice when they get up in the morning they have pain, especially around this area. Sometimes headaches, and because they do it subconsciously, it is not something they can stop by themselves. We can prescribe them the first thing we start off with jaw exercises, and I can
Mm,
actually send you a link if you want for your patients,
right.
and it will definitely help them. And if the jaw exercises don't help, you could wear a night guard.
Mm,
If you're doing it at night time and you think in the morning you're waking up with that pain, a simple soft night guard on your top teeth will actually solve the problem.
right.
Yeah.
Right. Um, okay, I think one of the things that often people struggle with is, and some places I know that it's the feedback's been very inconsistent. So some
Mhm.
people have given feedback that they give detailed medical history to their dentist when they go,
Mhm.
but others were not so specific about it. So what information must patients always share with the dentist?
No, you must, this is very important. Every medication you are taking, whether it's a prescription or over the counter one, you must inform your dentist on your visit to them so that the dentist takes into account, because there's so many interactions between medications and also the treatment. For example, anticoagulants, very important. You have to tell your dentist.
Mm.
And other medications as well, diabetic medications, all of them. Just let your dentist know, because not only like for example diabetes, it can create a medical emergency, isn't it? You could have an hypoglycemic and your dentist may not know. But if you
Mm.
have told the dentist that, oh, I'm a diabetic, he'll know how to deal with you straight away.
Right.
Same if you're asthmatic, please do tell the patient, tell your dentist that you're asthmatic, because you could have an asthmatic attack in the chair, and it's something very easily sorted out if the dentist knows that you're asthmatic.
Okay. Okay.
Also, carry your own inhalers with you. Another thing is people on the GTN spray.
Mm.
Carry with it and tell your dentist that you are taking a GTN spray.
Right. Okay.
It will avoid a lot of medical emergencies that way.
Right. Right. Um, One other question is, if I need to go for a tooth extraction, again, what are the precautions that I should be taking, or what should I make sure that, again, I've discussed with my dentist?
When okay, I need to understand your question. What do you mean? What precautions, like
I
before
don't
and
know.
after?
So, for instance, it could be obviously make sure that the dentist knows your medical history, right? Because
Yeah,
often
yeah, yeah.
people, in India often kind of self-diagnose and say, I think I need to go for a root canal, or I think I need to go for a,
Let's not
so they just,
let's not start brand ourselves anything. But yes, if you're going for an extraction, make sure you tell your dentist all the medications that you have taken this morning. A lot of patients take aspirin as a standard treatment for heart disease, and it can
mm,
cause bleeding afterwards. So if the dentist knows, maybe you can skip your aspirin dose just for that morning.
right,
And, and same with if you're on any other medication that can cause problems with bleeding, then yes, please do that. Make sure you eaten well before you go for your extraction. I know it's just
right,
a simple thing, but once you've had the tooth taken out, you won't be able to eat for at least a couple of hours. So it's best have a good meal, have a drink. Sometimes we recommend our patients to actually take a Nurofen an hour before the extraction,
mm,
so that the anesthetic tends to work better. When the anesthetic wears off, the Nurofen is still acting, so there is less pain.
right.
Does that answer your question?
Yeah.
Kind of.
Okay. Yes. All right. Any, um, let me just, I'll do a quick check if there's any other questions.
Before
Are there
that,
any issues or any, chronic conditions that we've missed out on that you think, um,
um, also many people, I don't know how much people who have the reflux,
mm,
they can bring out a lot of acid, and that can cause problems with your teeth, especially loss of enamel and dentine on the inner side of the teeth.
right,
And in those cases, we actually ask them to wear a night guard, because if the reflux is happening at night time,
mm,
it affects them. And again, another high fluoride toothpaste again is recommended there as well.
right, right. Um, okay, so one again,
Also, if you had radiotherapy for
mm,
any reason in the head and neck area,
right,
again, that is very important. It's a no go. So, if you are going to have a radiotherapy in the head and neck area for any oral cancers, make sure you've had a dental checkup. And again, all those teeth that are not good, they must be taken out prior
right.
to therapy, because the risk of jaw necrosis is terribly high there.
So they are taken out before you start on your
Before they
radiotherapy.
start taken out, it should heal completely, and then the treatment should start.
And is
Uh,
there any evidence or any experience on if people are on long-term hormone treatment for breast cancer, for instance?
Hormone treatment doesn't give you much trouble with teeth. No,
Okay, okay. So if people are observing certain issues, it's not necessarily linked to that treatment. It's just,
no. Hormone therapy doesn't really give you much problems.
and even chemotherapy, the effects is, I mean, there's no uh, late effects of chemotherapy, right?
It is while you are on chemotherapy.
Okay, okay,
If you are on chemotherapy, your platelet count is affected. But if you're on hormone therapy, your platelet count is not affected. So
right,
you don't seem to get much problems. Yeah.
right.
Mhm.
Can one suggestion that's come, I think she says, is I always apply my moisturizing mouth gel when I undergo a dental procedure. This is someone with Sjogren's and who has significant dry mouth issues. So this makes it easier to keep the mouth open.
Yeah, that's fine. Yeah, that's
Okay.
absolutely fine.
One question that does come up, I think, and I'm sure you faced it, is you've talked of mouthwash for a few things, but there is this concern that pops up every few months or years on mouthwash causing cancer or
Yeah,
having
I've
being
heard that.
harmful.
Yeah.
So,
So I wouldn't use personally. I'm not a great advocate for mouthwashes. I think if you brush your teeth, don't rinse your mouth afterwards. You're getting a two-in-one effect.
mm,
Also, quite a lot of mouthwashes do contain alcohol as well, so it causes a drying effect of your mouth. But
mm,
under certain circumstances, they are useful. Okay, if
right.
you're having chemotherapy, then yes, by all means, you should use while you're having chemotherapy either a Corsadil, which has got chlorhexidine, or a sodium fluoride mouthwash, where the benefits outweigh the risk.
Right, right.
Right?
And is there, I remember in one of our discussions on oral cancer, they also talked of just gargling with um, the bicarb, sodium bicarb.
Yeah, what happens with sodium bicarbonate? It gives so you get your fluoride, but you don't get your calcium and phosphates, and that
Mm,
comes from the sodium bicarbonate soda mouthwash, and that's fine. Yes, a teaspoon of soda bicarbonate, just your household one,
mm,
and in warm water, swish it around your mouth twice a week, 3 times a week. That's fine. That's absolutely fine.
right. Okay.
And that is also good for people with Sjogren's syndrome. Anybody who has dry mouth, it
Mm,
will protect you from decay.
okay. And that you would suggest doing a couple of times a week or
Two,
every
three
day?
times, 2, 3 times is sufficient. I mean, if you're really high risk, then yes, every day. But
Right,
otherwise, 2, 3 times a day is
right,
fine.
right.
I don't know. We have something called GC Mousse, which does the same thing. With like bicarbonate of soda, which is of course 3 to 4 times the price. But
Mm,
I find if you got some bicarbonate of soda, just do it. Mhm.
right, right. Okay. Um, any other final tips or any advice to our audience?
Yeah, I would actually. One of the most important thing is I find kids or even us, cup of tea. If you've got sugar on it, you're working. Most of the people are working from home now. You have a cup of tea, especially or coffee or fizzy drink. You have a drink. You put it on the side. A few minutes later, you have another sip. Remember, if you drink a cup of tea in one shot, it's one exposure. You drink that same cup of tea in 5 shots, it's 5 exposures,
Okay.
right? You're flooding your mouth 5 times.
Hmm. Okay.
So
That's an interesting one. I didn't think of it.
drink it in one go. It'll be much better for you.
And it doesn't matter if that, if you're having like a green tea or a herbal tea, uh, are
No,
they
it depends
equally
if you put
bad
sugar
or
in it. If you put sugar in it.
is it sugar? Okay. So
If
if
you
it's
don't
no
have sugar, that's fine. That's absolutely fine. And the same thing, I mean, even with children, give them a drink with their meal, it's fine. Because the way decay works is to do with your pH of your mouth. If your
Hmm,
mouth is acidic, and that's what the drink, any sugar does, it makes your mouth acidic. But if you're eating with other things, then the pH becomes back to neutral, and then you won't have the decay.
right.
Oh.
Okay. That's very
And
useful
most
advice.
important, flossing and interdental cleaning. I think that's really important because we tend to forget that.
Mm, mm,
And
yes.
that, yeah. Mhm.
Okay. All right. So thank you, Maria. It's been a very informative session, and I think we've addressed a lot of different questions across a wide range, and you successfully danced around one topic of.
Well, I hope it has been useful. I do hope. And if there are any questions afterwards, or any help or any information, send me an email. Quite
Sure,
happy.
sure. Will do, will do. Thanks, Maria, and thank you to our audience for tuning in and listening. And hope you promise to floss and to brush
Yeah,
as Maria suggested, and the interdental. Don't forget.
yeah, don't forget that. We all want good teeth.
Right, right. Okay, all right. Thank you,
Thank you,
thank
everybody.
you.
Thank you.